We aren't too far, but we're not too close either. We are close in a sense that there are things we can do now, and I refer to, for example, if you look at some of the genes that mutated, we can prescribe certain drugs. I talked about. We have started, and I look at the NGS, for example, as a very first and important step in moving towards that. So we have already started the process. The process has already started. And there's nothing more than pancreatic cancer that deserves a personalized treatment, because it's a disease that we don't have good treatments. It's a matter of looking for mutations. Some call them rare mutations. They may be rare, but for a patient, it's very valuable. And unless you look for it, you will not find it. So the short answer is yes, there are options now for patients to go into a personalized treatment kind of mental or strategy, and there is definitely room for that, and it already started. But it's a matter of people trying to buy into it and believe in the fact that there might be rare chances to some patients, but at the same time, anything is worth for a patient, because especially in a disease like this, where the alternatives aren't good, the alternatives, as we call them, alternatives in terms of standards of care. Because even in patients who we see them who are curable, like they have localized disease, and then we do surgery, unfortunately, a good number of those patients will have a recurrence of the disease, and most of them will die of it. So anything we do to help the patients will be important, even if we're talking about very small percentages who may today go on a personalized treatment. But that's increasing. With time, it's going. So maybe if I come back in 5 years' time, it will be much more of that happening. But now it is happening. It's not like it's not happening.